welcome all of you to the Oncology Data Advisor Live Fellows Forum. We're so excited to be here today with 3 of our Fellows Forum members, Dr. Sam Kareff, Dr. Waqas Haque, and Dr. Matt Hadfield. It's so awesome to finally see all of you in person, especially after doing so many Zoom interviews this past year, and it's wonderful to finally get to connect here.
Yeah, thanks for having us. Absolutely.
So would you like to first start by going around and introducing yourselves?
We always start with Sam.
Hi, everyone. My name is Dr. Samuel Kareff. I'm the outgoing Chief Fellow at the University of Miami Sylvester Comprehensive Cancer Center, Jackson Memorial Hospital. I'm very pleased to be here with my colleagues today at another wonderful ASCO meeting.
Hey, everybody. I'm Dr. Waqas Haque. I'm wrapping up internal medicine residency and clinical investigator track at NYU and starting East Chicago Oncology Fellowship on July 1st.
And recently named 40 under 40.
Cancer.
Congratulations.
So much. Thank you.
Absolutely. Congratulations.
Thanks so much.
I'm Matt Hadfield. I'm a third-year medical oncology fellow at Brown University in the Legarreta Cancer Center in Providence, Rhode Island, and I'll soon be joining the faculty there, focusing in phase 1 early drug development and melanoma.
Amazing. Super excited to be able to do this Live Fellows Forum today. So how have each of you been enjoying ASCO so far?
I guess I'll start by tradition. It's just been a really wonderful meeting. We were just kind of reminiscing beforehand to kind of have our paths cross across the country, across the globe, and to meet with so many co-investigators, partners, patient advocates. It's just been a wonderful opportunity.
Yeah, this is my second year going. It's obviously a privilege to be able to go to residency where your schedules can be really tight. But yeah, I think just amazing networking opportunities and getting to meet everybody in person.
Yeah, I think ASCO is honestly like one of the most special meetings because you run into old friends, people you trained with, but then you quickly start talking about trials and things that are going on, and then before you know it, you're developing ideas and concepts, and it's like the only things that can organically happen when you bump into people at a place like ASCO. So it really is a special meeting.
It definitely is. What are some of the benefits you've particularly found of attending ASCO as a resident or a fellow?
So, I met you, Kira, just a couple of years ago at a poster session. We were talking about HRAS mutations in breast cancer. Thankfully, our pan-tumor analysis was recently published in the Journal of Cancers, but even that brief interaction kind of launched our collaboration here, right? And it's like Dr. Hadfield was saying, these little interactions lead to such great opportunities. So as a fellow, especially in this Fellows Forum, I'm just very thankful for the opportunity and look forward to kind of expanding it for other fellows across the country and hopefully across the world.
Yeah, and for me, just as an incoming oncology fellow, I think just access to mentorship opportunities is really great here. They have an early career track in the lounge where you can go to find mentorship opportunities, get one-on-one sessions with attendings and people who are involved in admissions, and just getting that whole experience and meeting with others, residents and incoming fellows is a huge opportunity.
Yeah, no, absolutely. And I think one of the unique things about ASCO that maybe we don't talk about enough is that it's really one of the meetings where industry and academics are so closely meeting together, and it really does offer some unique opportunities, particularly as a fellow, just getting a little insight into how those relationships are built and how they're fostered, and how you can take ideas and develop IIT concepts by working with companies and how that process works. And I think you start those relationships at ASCO, which is really important, and it can start as a resident, as a fellow, and carry on into your career.
Yep, definitely a lot of opportunities there, and like you said, you can meet someone by chance, and sparks into a whole collaboration. So definitely a lot of opportunity. So for those of you who are presenting posters or sessions or are authors on any research here, would you like to tell us a little bit about the research?
Oh, sure. We've been really blessed at the University of Miami. I actually presented at a aligned meeting on Thursday, a cost-effectiveness analysis that was published in JAMA Network Open. Yesterday, I had an update in the ASCO Oncology medical education community of practice, where we talked about updates in medical education, very topical for this forum, of course, followed by a poster leading to a phase 1 trial we're opening at the University of Miami looking at the TEM8 biomarker in small cell lung cancer. And then after this, we'll be going to the trainee lounge to kind of talk about ways to exceed in fellowship. So very topical for this forum, very productive, and like we were kind of reminiscing before this as well, these opportunities just kind of keep escalating as you progress through your career. So it's just a wonderful opportunity.
I've been very fortunate as well to be a co-author and presenting on several interesting things that we've been doing at the Legarreta Cancer Center. One thing with Jeremy Warner's group, who leads our bioinformatics department, has been looking at accelerated FDA approvals, and essentially the timing between what we are doing with the FDA and the European regulatory affairs, and looking at that from kind of a higher level view and seeing what the time to accelerated approvals are, but then what is the outcome in terms of subsequent approval with phase 3 data, and if we need to kind of rethink that. And there was a very interesting poster at AACR that looked at a very similar topic, and I think the accelerated approval process is great in many ways, but there's also a lot of ways in which I think it could be improved, because we have seen some approvals get taken back by subsequent phase 3 data that just didn't pan out. And another very interesting thing that we're doing, Don Dizon is an investigator at our cancer center who did an IIT with Bristol Myers looking at ipi-nivo and extrarenal cell clear cell carcinoma, and fantastic response rate. It's an oral presentation this morning, so we're really proud of him and happy to be doing that at our cancer center.
Awesome. Congrats to both of you on this research here. And Waqas, huge congratulations to you for winning the Cancer 40 Under 40 award. Would you like to tell us a little bit more about this recognition?
Yeah, thanks so much. So I had the award ceremony last night, and basically it's an award for 40 people, under the age of 40 who are involved in cancer care in some way. You don't have to be an oncologist necessarily. You can be a researcher, you can be industry, nonprofit. It's really awarded to 40 people across different areas, even nonprofit as well. And it was pretty interesting. I mentioned at the award ceremony that among the 40 people were picked, but there are 2,500 applicants, about a 1.6% acceptance rate. So that was kind of cool. But it was really special because my fiance was able to be there with me, and she actually won the Forbes 30 Under 30 this past year. So
wow,
it was kind of cool to go. But yeah, and I think the reason I got the award was basically for my research in value-based care. So Dr. Hadfield was talking a little bit about accelerated approvals, and so one thing that I was researching that got published in JAMA Oncology last year was looking at a study about the delays between approval for a drug in oncology and then coverage by insurance companies. Because even if a drug is technically approved, it might not actually be in the hands of patients or available to them for many months to years after. So that was one of the key papers that kind of helped me get this award.
Awesome. Congrats again.
Thanks so much.
Congrats to your fiance as well.
Thanks so much.
So we're so excited to be launching the new version of the Fellows Forum 2.0, I like to say, where instead of just having the leadership board with you as well, steering the conversations, we'll also be opening it to other fellows who are interested in joining and becoming part of the discussion boards. So for going into this, what have each of you enjoyed the most about being part of the Fellows Forum over the last year or so?
I think we've really covered a lot of the ground here. It's just a great opportunity for a lot of connections, and honestly, fellows and other trainees maybe traditionally have had less of a space at the table and less of a voice in these conversations, and I think opportunities like these really elevate those voices, which are just so crucial to making sure that there's adequate representation. So I'm very thankful for that, and like I said earlier, really invite all fellows and other trainees as well to join the forum if possible.
Yeah, just because the internet, there can be so much access to information, it's very hard to rely on things. You might not be sure it's accurate, so to have a place where there's expertise and there's curated discussion, I think is really important because you don't really have those spaces online.
Yeah, no, absolutely, and I think one of the things that I found so great about this and hoping to see it evolve in the future is that I think the paradigm's sort of shifting a little bit in mentorship in oncology and across other fields too, but I think the idea that you go to a fellowship and you find a mentor there and that's it, and they're kind of responsible for your career, like I think and some of this I think is coming out of the post-COVID, everyone's so interconnected more with the ability of Zoom calls and things, that these communities can form and you can find mentors at other institutions and you can really build your network a lot easier, and this type of forum is really perfect for that. So it's been great to be involved.
Absolutely. What can other fellows look forward to, what kind of benefits can look forward to, such as collaboration and networking with other fellows, and why should they join?
So our new fellows forum, well, in first place, you'll get to hear my voice less, which is fantastic for everyone involved. But seriously, like Dr. Hadfield was alluding to, I think you'll be able to get these more organic connections. Another thing that's kind of changed through the pandemic and training, not only at the fellowship level, but really at all trainee levels, is you can look outside your institution, but you also don't need to go through that straight hierarchy we've been taught. You have to go to like the senior investigator in your institution, or maybe someone who's a expert in your site disease group. You really can work with other trainees as mentor-mentee relationships. You can work with folks who aren't even in the pathway into organized medicine yet. So really the opportunities are endless, and that's wonderful.
Yeah, even when it comes to things like research, of course, sometimes there might be confidentiality HIPAA that prevents you from collaborating across different institutions. But even doing things like literature reviews, case presentations, just basic articles online, those are new opportunities that can open up, even if you're not able to get access to a different institution's data.
Yeah, and I think too, having people who have been in the same situation you've been in at other institutions, maybe they don't know exactly how it works at your institution, but they can help you kind of navigate the roadblocks that we've all encountered before. And for instance, Dr. Kareff just talked about how he took a translational project and turned it into a phase 1 concept, which is amazing. But as you know, there's a lot behind the scenes on that. There's a lot of interacting with the company. There's a lot of developing an IIT. There's a lot of regulatory aspects to that. If you're at a center where you don't have a mentor that's helping you do those things, and you want to be a clinical trialist or working in early drug development, the Fellows Forum offers those organic opportunities to find someone who, as you said, like another fellow can mentor you through the exact same things that we've been going through. So it's really perfect for those types of things.
Absolutely, looking forward to all these opportunities. So we've done so many fantastic videos and podcasts on the Fellows Forum this past year, from Cancer Awareness Month to Waqas's AI and Tech series. What are some of the other topics that you're looking forward to covering next?
I think we highlighted a couple here that the Fellows Forum might think about incorporating in the future, things like value-based care, things like regulation, and looking into working with regulatory agencies, even things like early phase trials. These are topics that we talk about traditionally in our more organized didactics, but things that we can expand in the Fellows Forum, which will be really great.
I think for me, just going from a resident to a fellow, so last year I was talking a little bit about the application process, and now just be able to go through that experience of fellowship and just sharing that with people will be pretty fun.
I think there's a lot of things too that we talk a lot about, and the Fellows Forum can help maybe create that groundswell of actually changing some things. And the things that come right to my mind is diversity in clinical trials. I think we've been talking about this for decades, but oftentimes these conversations don't really go anywhere. And depending on where you're at, what the priorities are, how your own center is dealing with that. Creating a community of fellows that, conversations like this can happen amongst trainees, and then we're growing the next generation of clinical trialists. Maybe we can really actually come up with some concrete solutions instead of just identifying a problem no one wants to actually take on and make a solution for. And I think another area of interest for me that I'm particularly passionate about is immunotherapy toxicities, which I probably talk about too much, and everyone's sort of sick of hearing about it. But I did want to highlight that that's something that I hope to continue talking about in the Fellows Forum, and we actually, in a multi-center collaboration, have created the Aspire group, which is both a consortium on developing immunotherapy toxicity programs as well as a patient advocacy group. And we had our first meeting yesterday. So I'm hoping to highlight that more, and I think raising awareness about toxicities, and as we start trickling these into earlier phases, a lot of patients are going to develop chronic toxicities. A lot of patients are going to develop, late onset toxicities, and we have to have that information and collaboration to identify them better and counsel patients on those toxicities. So I think those are all things that, as Dr. Kareff was mentioning, we don't really get a lot of that in didactic lectures, right? In fellowship, a lot of it's just, we need to have conversations, and the Fellows Forum really fosters that.
Absolutely. We're looking forward to covering all these topics. Awesome. As we wrap up, anything else any of you would like to mention about your ASCO experience or your fellowship experience in general?
If there's one tip I have for all trainees who are interested in oncology, try to come to ASCO in person at least once during your training. There's obviously a lot of barriers. It might be institutional approval, funding, etc. But I do think it's highly worth the cost and the time. As we've mentioned, a lot of connections develop organically here, and you can't get that from being virtual.
Yeah, even I think taking advantage of the resident and the fellow track is really important. And there's also a separate, medical student research symposium they have. So even if you can't get into the main ASCO conference for your abstract or paper, at least trying to get into there will still be very meaningful.
Yeah, absolutely. I think as someone who's interested in applying to oncology, or someone that's training in oncology, ASCO really is one of the most unique experiences in the world. You're never going to have a situation where there's this many people in person. Even if you're not presenting, as has been alluded to, the early trainee lounge is perfect. And I would say the biggest advice is that ASCO can be so overwhelming. There's like 40, 50,000 people here. There's so many sessions. Come with a plan, but also do not be afraid to introduce yourself to people, because a lot of times, especially when you're training, you're like, people don't want to talk to me. You feel kind of small, but everyone's happy to talk, everyone's happy to chat, and you never know if that could lead to where you go for fellowship or a research collaboration or just a mentor. So put yourself out there.
Definitely. It's a great way to wrap up. Awesome. So thank you all so much for coming by today. It was wonderful to finally do this in-person Fellows Forum, and looking forward to working with you all a lot more in the next year.
Thanks
so much.
Thanks, co-panelists.
Thanks, yeah.